Hey guys, it's me, Will. Um, I'm wearing my Teenage Mutant Ninja Turtles tank top, and I like this tank top because, well, I'm a huge Teenage Mutant Ninja Turtles fan, have been ever since the 80s, and I like how this makes my chest look because it makes it look a little well defined up here, and uh, and it doesn't really show any definition down here because I haven't really built up my chest at all, but right up here um it looks a little more well defined, like there's natural, like like I was building up some muscle, which it's just natural muscle right there. But anyways, in this video, had hair on my phone. Okay. Um in this video I want to talk about, do I want lower surgery? And the answer is yes, I do. I've always wanted to have metoidoplasty, but a little bit ago, like a few days ago, I was watching some videos on YouTube, like listening to Cody Harmon, um, and other people who actually had phalloplasty, and I was like, okay, if I was going to have phalloplasty, I would have radial forearm flap, um, because if they take it from your butt or your leg, it's just too girthy. I think it would be too girthy for me. Um, and I thought, okay, so I did some research and watched some more videos, and the complications that people go through who've had the surgery, like strictures, which are where your urethra narrows and possibly closes up completely. Um, that fistulas, and with any surgery, there's risk and there could be complications with any surgery. Um, I mean, when I had my gallbladder out, there could have been complications with that, but luckily there wasn't. And the recovery was very easy. I hurt for the first few days, but then after that, I just had to be careful, and it's been over a year now. Um, and I'm really happy that I got that out because I was having a lot of pains and just not feeling good at all, um, most of the time. But now I feel better, even though I have fatty liver. But I'm doing something about it where I've completely cut out sugar sodas, and that was like my vice. That was like my one huge addiction, was sugar soda, especially Coca-Cola. That was one of my huge vices. But anyways, I'm getting off subject. Um, with lower surgery, the complications due to phalloplasty are, oh my god, way. I just don't feel comfortable personally. I don't feel comfortable um having a really high risk of all those complications that could happen. And I watched a couple videos from this one YouTuber. I don't remember his name, but he ended up with a blood clot in his leg and then in his lung. And that really scared me because a blood clot can dislodge and go right to your heart, and that's it. And you're done. Um and you're done for. Um so that type of complication is scary. Um Luckily I haven't had any problems with blood clots, but that can change because when when we get older, our bodies can change. They change from day to day, year to year, month to month. Um, where you could be eating, let's say you've been eating pineapple ever since you were a little kid, and then all of a sudden you break out in a huge rash after you've eaten pineapple. Your body changed. Your body chemistry changed. Um, so I thought about it and I was like, you know what? I don't want to take that big of a risk to have phalloplasty. yeah, the you know, with metotriplasty, you are just stuck with what you grow. And yeah, it's going to be small. Um, but at the same time, it's, you get a natural erection. You can stand to pee. Um, and to me personally, that the risks with metotriplasty seem to be a lot simpler and lower than high complications with phalloplasty. So, um, I thought about, yeah, length would be good. Um, glansplasty would be good. Um, yeah, you end up with a scar on your arm, but that I've seen results where it looks like nothing ever happened, pretty much. Um, which is nice. But at the same time, it's just, it's just the risks are just too high for me. And people who go for that surgery, like if you want phalloplasty and you go for it, more power to you. Seriously, more power to you. And I hope, and my thoughts go out to you that it goes well, and you can survive these complications if you have any, um, which is pretty um, pretty big. So, um, and I thought about length would be nice. Um, I wouldn't get a um, erectile device because I would, because personally, I'm a virgin. I never had sex. Came close once, but never had sex when I was a female either. And I have no, like, before my hysterectomy, I, I had a little bit of a sex drive, but after my full hysterectomy, none. No sex drive, no desire, nothing like that. And I'm pretty happy with that, actually, because abstaining from sex is like the healthiest thing, because there are so many complications. Like you can get an STD really easily. It only takes one time to get an STD, and even if you use a condom, because they're not 100% effective, they're like 97% or something like that. But um, I think they're 97%, but I could be wrong. Um, but they're not 100% effective. And you know, I'd rather have be healthy than have an STD like the clap, um or even HIV. I would rather not have that stuff. So I would basically have, the length and be happy, but complications. I just don't want to, have the complications. So, anyways, um, with metotriplasty, I would have it done up in Denver Health. Um, I just got I'm on Medicare, Medicaid, and I've been on Medicare since I was 26 when I started getting SSI and SSDI. And I just got a supplemental insurance with Medicare, Anthem, Blue Cross, and Blue Shield. And I just called them the other day to see what they offer for trans health. And they pay for hormone therapy, they pay for lower surgery. Of course, with lower surgery, I have to get a pre-authorization from them, but that's not an issue. I'm not on any testosterone at all. I'm not even on any estrogen right now. I was on estradiol after my um, hysterectomy, but I quit that a few months ago, and And I think my testosterone levels, natural testosterone levels, are a little higher because I've been getting a little more chin hair down here. It's very light, but some little extra strands of chin hair, chin chin whiskers, and I've also, I think my voice has gotten a tiny bit deeper, maybe just a tiny bit. Um, but because uh, I was at my doctor's office yesterday, and I was like, sometime I would like to have a blood test just to see where my estrogen and T levels are at, you know, naturally, because I've been off estradiol for a few months now since, like, what is it? Since fall of last year. So several months, and and I haven't had any problems with it. I'm happy to be off it. Um, because with estradiol, it was basically estrogen, and it was like, I don't want to be on estrogen. My body doesn't produce it anymore because I had my ovaries removed. So, you know, but anyways, with metotoiplasty, I'd have it done up in Denver Health, and I would have urethral lengthening, vaginectomy, scrotoplasty, and I would hope to get it all done in one surgery, so I only have to heal one time. And because I want to be able to stand to pee. I don't care if it's small. I don't care. I want to feel more comfortable in my body down there. And I've even thought of getting like a testosterone booster and starting that way. But at the same time, I'm like, no, I want to do it the right way, do it medically. Um, you know, even though the changes will start kind of slow, could start pretty slowly, but I want to be able, you know, because I want my voice to drop. I want facial hair. I want fat redistribution. I want all of that, because I've never being trans. I've heard some other people like saying, being trans is hard. And for some people it is. It is, and that my heart goes out to them. They may not have the supportive family. They may not have the resources to get top surgery or insurance to pay for it or whatever. But for me personally, being trans is like the best thing for me, because from when I had my top surgery, after my top surgery, I was like, best decision I ever made. After I had my full hysterectomy, best decision I ever made. And when I get on testosterone, after I drop this weight, which, by the way, I've lost 9 pounds on Weight Watchers so far, and that's awesome. So I'm 9 pounds lighter than I was. Um, anyways, um, for me being trans, I'm living my life the way I know I should be living my life, where I should have been born male. I should have been born male. Um, and luck of the draw, I just got born female. But there's a way to remedy that. And that's freaking awesome. So, so to answer the question, yes, I want lower surgery. Yes, I want metotioplasty with urethral lengthening, vaginectomy, and scrotoplasty with testicular implants, and hopefully get it all done in one surgery. If it's a couple stages, that's fine. Um, but hopefully all done in one surgery. Um, and I just hope that, if However, you are just starting your transition or questioning if, am I trans? You know, I followed these few basic things where I was questioning if I was transgender. And one thing that came up was sex or relationships and sex. I knew I didn't feel right being the girlfriend in the relationship. I wanted to be the boyfriend. I didn't want to be the one being penetrated. I wanted to do the penetrating. You know, and and then having very large breasts, hating them, hating having a period, that it was just wrong from the get-go. It was wrong. Um it felt like my body was betraying me during that time, especially when puberty hit. Worst time of my life. But I remedied those two things. Um, so, anyways, if you're questioning if you're trans, just be like, okay, with past relationships, did I want to be the girlfriend? And if not, I wanted to be the boyfriend. That's one indicator. That was one indicator for me. Um, do I want boobs? No, I don't. And some trans men like to be penetrated. And, hey, more power to you. It's your choice, your preference. For me, no. Um, but I'm just one individual. I'm just one person. And if you're trying to, if you're just starting out to transition, um, go see a therapist, find a therapist to start the therapy process. Um, and if if you're one of the if you're one of the few people, basically not few, but one person who isn't getting the support you need, like from your family, from some of your friends, or all your friends, or whatever, you know, find people who will support you. Go to a support group. Um, and some people have transitioned behind their families' backs by not, letting them know about, what's going on with them, because there's a fear of not being supported. For me, I was really lucky to have the support. I have very supportive parents. All my friends are very supportive. My older sister is, well, she's kind of supportive, but not really. My niece and nephew are supportive. My oldest brother, and sister-in-law are really supportive, and my niece calls me Uncle Will, which is awesome. And um and my other older brother, he, well, he's my older brother. Let's just put it that way. I just kind of wish he was a little more, because I used to look up to him big time. We were really close when I was growing up. And well, he changed. He got, you know, crazy. Not like psycho crazy, but he changed. Um, Mentally, we drifted apart, and I just didn't like it. But anyways, um, so I have most of my family supportive, which is great. Um, my sister doesn't really get the whole transgender thing because she sees me as her disabled um, little sister still. But it's like, no, I'm your little brother now, and please, you know, she doesn't call me by my chosen name. Um, she basically says, "Hey, you." which it's better than being called by my birth name, Lauren. That was my birth name. It still is, but because I haven't legally changed it or anything. But I think that's going to change because I plan on getting my name changed and my gender marker changed. I think within the next few months to a year. Um, anyways, this video is getting really long, so um, just if you're starting your transition, even if you're a kid and you're starting your transition, like I didn't transition in high school, which I kind of wish I did. Not kind of wish, I wish I did. Because I would have gotten on hormones and probably have already had lower surgery already, and be more comfortable in my body. From the waist up, I'm comfortable. From the waist down, not. But anyways, I was all over the place in this video, but um, if you're starting your transition, try to find a therapist that deals with transgender people. And try, find a doctor that that knows about transgender health, which helps. And if you're not out at work, be stealth, because if you're afraid you're going to lose your job, that's fine. It's your choice. But anyways, this video is getting kind of long. I'll make another video about how to transition and later on. So see you guys later.